Hello, this is Abirami doing my post-graduation in sports at Saveetha College of Physiotherapy. I am here today to present a case study that examines the impact of a ballistic training protocol on a 20-year-old female cricket bowler. She is a university level cricket bowler. So next, cricket is a sport that demands repetitive overhead movement, especially from bowlers, and this exposes them to a significant risk of shoulder injuries. My study focuses on how sport-specific ballistic training can help enhance performance and reduce the injury risk. So in cricket, bowling is a ballistic action, meaning it's explosive and involves rapid generation of force through the shoulder and trunk. This repeated overhead action places substantial stress on the shoulder joint and the surrounding muscles. So without proper conditioning, athletes, particularly female cricketers, are vulnerable to overuse injuries, instability, and performance decline. Unfortunately, strength and conditioning programs in cricket are often designed for male athletes, and many female bowlers don't receive customized upper limb training. That's where the Ballistic 6 exercise program comes in. It's a functional sport-specific plyometric protocol tailored to replicate the movement patterns seen in bowling. The previous study have shown the benefits of ballistic training. Number one is the Simran Nag et al. Who published in 2021. She conducted a study on the effect of ballistic 6 exercise and TheraBand exercises on physical performance in badminton players and concluded that 8 weeks of ballistic 6 training may help improve the strength, agility, speed, and function in the badminton players. And another literature, say the Singh A et al. In 2014, conducted a study on the effect of ballistic 6 plyometric training on performance of medium-pace Asian cricket bowlers. So it concluded that ballistic 6 plyometric training is an effective way to increase bowling performance, strength, power, endurance, and proprioception, which also decreases the risk of shoulder injuries in cricket bowlers. Another author named Bogian R. et al. In 2022 conducted a study on the short-term in-season ballistic training improves power, muscle volume, and throwing velocity in junior handball players, and he also concluded that this ballistic training has greater improvements in peak performance, muscle volume, throwing velocity in junior handball players. Another named Naveed Ashfaq et al. In 2019, he conducted a study on the effect of plyometric training program on speed and agility in young cricketers. So this ballistic 6 training is also a plyometric training. So this was conducted in prediction gym where 40 samples was randomly allocated, where the plyometric training group and the traditional training group, these both got their own training protocols and with 20 participants in each group. So this concluded that both plyometric and traditional training improve speed and agility among the cricketers. So background of the study, cricket bowlers, particularly the fast bowlers, experience high rate of shoulder injuries due to the repetitive overhead throwing motion. These injuries can significantly impact the performance and career longevity. Improving dynamic stability, the ability to control the joint motion during forceful movements, is very crucial for the prevention of injury in overhead athletes, which include the cricket bowlers, and shot put players and all the overhead athletes. However, the Ballistic 6 program incorporates plyometric exercises designed to enhance the stretch shortening cycle, potentially leading to greater power and dynamic stability. Research is needed to compare the effectiveness of these programs in female cricket bowlers. Research gap and need for the study. The increasing evidence of shoulder injuries in female cricket players highlights a need for targeted and sport-specific intervention. Despite the known biomechanical demands of bowling, there is a lack of evidence on shoulder-specific training for female cricketers. They often experience performance limitation due to weak neuromuscular control or instability in the shoulder girdle. Given the fast and accurate throws are essential for performance, and the shoulder strength and stability play a very pivotal role, in it's crucial to identify which training program is more effective to enhance the upper limb function. As modern cricket places high physical demands on athletes, training strategies that replicate the game-specific condition and optimize the neuromuscular recruitment are needed. So this study addresses a major research gap by testing a functional ballistic-based program on an actual cricket bowler in real conditions. The aim is not just to prevent the injury but also to increase the performance. So the aim and objective of the study: aim is to evaluate the effect of Ballistic 6 exercise program on shoulder dynamic stability, throwing accuracy, and upper limb strength in a 20-year-old female cricket bowler. So the objective of the study is to assess the baseline shoulder dynamic stability, throwing accuracy, and upper limb strength in a university level female cricket bowler using the standardized outcome measures. Then to implement an 8-week Ballistic 6 exercise program targeting functional movement patterns specific to overhead throwing and bowling actions. Then to re-evaluate the post-intervention changes in dynamic stability, throwing performance, and shoulder strength using the outcome measures to determine the functional impact of sport-specific ballistic training performance and injury prevention protocol. Methodology. So this is a single case study which was conducted on a 20-year-old female cricket bowler. She is right hand dominant and who is actively playing at a university level. So the duration of the intervention was 8 weeks. Frequency is 3 sessions per week, which is non-consecutive days, and each session is conducted for 50 minutes. Warm up and cool down was followed. The inclusion criteria are: she should be a university level female cricket bowler aged between 18 to 25 years and no history of acute shoulder trauma, willingness to participate for 8 weeks, active participation in competitive cricket as a bowler for more than 1 year. And the exclusion criteria were: she should not have any current musculoskeletal injury or history of dislocation or surgical intervention, and presence of neurological or systematic conditions affecting the upper limb. Next comes the study procedure. The study began with a thorough introduction session for the subject. During this session, she was given clear information about the study's goal, how long it would take, and the types of exercises they would do. The subject also signed a consent form to agree to take part. On the first day, a detailed checkup was done before the program started, which included 3 specific outcome measures, that is the upper quarter Y balance test to check the shoulder stability, and the throwing accuracy test to see how well the cricket bowler can throw, and the seated medicine ball throw test to measure how strong and powerful their upper body was. After the pre-test, subjects began to start the Ballistic 6 exercise training program. The study was conducted over a period of 8 weeks, and the subject underwent the Ballistic 6 exercise program, 3 sessions per week on non-consecutive days. Each session lasted approximately 45 to 60 minutes, including the warm-up and the cool-down. In first 2 weeks, a 2 kg medicine ball was used to focus on movement and coordination. From week 3 to 5, repetitions was increased. In the last 3 weeks, 3 kg medicine ball was used and performed the exercises at a full speed, which mimic the explosive actions needed in the cricket bowling. After the completion of 21 sessions over 8 weeks, the same pre-assessment tests were repeated. Weekly subjective feedback was collected from the subject regarding the fatigue discomfort or perceived exertion using the BOG RPE scale. So any sign of overuse were monitored. The subject remained injury-free throughout the study procedure. So the protocol which we followed is: the subject were asked to begin each session with a dynamic warm-up of general mobility drills and rotator cuff activation. The Ballistic 6 exercise programs are external rotation with latex tube, 90-90 external rotation with latex tube, overhead throws using a 2 kg fitness ball, and 90-90 external rotation side throw using a 2 kg fitness ball, and deceleration throws using a 2 kg fitness ball, and then baseball throws using 2 kg fitness ball. So the outcome measures used were upper quarter Y balance test, which measures the shoulder and core dynamic stability, performed in 3 reach directions: medial, superolateral, and inferolateral. Then throwing accuracy test. This is a custom test using a cricket ball and target zones. 10 throws were recorded, number of hits were noted. And seated medicine ball throw test. which measures the upper body power. The subject was asked to sit on a floor, and 2 kg medicine ball was thrown, seated at 90 degree against a measuring tape. Next comes the result. So the upper quarter Y balance test, that is the shoulder dynamic stability. The average reach distance was 72 centimeter pre-test and 84 centimeter post-test. So the percentage of improvement is 16.67%. And throwing accuracy hits out of 10. So pre-test was 5 and post-test was 8, which showed a 60% of improvement. And the sitting medicine ball throw test, that is throwing distance, was 4.2 meter pre-test and 5.6 meter post-test, which showed a 33.3% of improvement. Finally, we'll come to the discussion. So this study focused on how the ballistic 6 training affected the shoulder stability, throwing accuracy, and upper body strength in a 21-year-old female cricket bowler. The participants showed clear improvements in all areas. So these findings align with previous ballistic training studies in overhead athletes. So ballistic 6 exercises activated fast twitch muscle fibers, which improve the neuromuscular coordination and enhance the proprioception, all of which are critical in bowling. It's worth noting that such explosive training programs are rarely prescribed to female cricket bowlers, even though they perform the same high velocity actions as male athletes. So this study proves that structured progressive ballistic exercises can both enhance performance and reduce injury risk in female cricket bowlers. There are some articles which support our study, that is Simran Nag et al., which was published in 2021, Mona Abada, which was published in 2022, and by Bogian, which was published at 2021. So in general, this study shows the ballistic training can improve upper body performance in sports that require the overhead movements. Then we'll come to the conclusion. So this study concludes that ballistic 6 exercise program is effective in enhancing the shoulder dynamic stability, throwing performance, and shoulder strength among the university level female cricket bowlers. By emphasizing explosive high velocity movements, the ballistic 6 training protocol facilitates improvements in neuromuscular coordination, rapid force production, and joint stabilization, all critical for optimal bowling performance. Incorporating ballistic 6 exercises into regular training program for female cricket bowlers is recommended to enhance the performance outcome and promote the shoulder health. Future studies should further investigate the optimal training duration, intensity, and application of ballistic 6 exercise across different athlete population and levels of play. So these are the references. Thank you all.